my pieces.
Hi, my name is Abby James, and in this video I'm going to be demonstrating how to assist with a canine spay. So we have our patient on the table here, and I'm going to go ahead and open her surgery pack. Okay, and we're going to wait on the suture for a few minutes.
Now I always wipe. I always have in dogs. I'll spread and thin the skin out. Now they have a vessel right there. You'll never get around it. It's forever that location. Cats, you can sometimes get around it. The dog is gone. And I stay midline the whole way. And sometimes, if you look close enough, you can see the spleen coloration right up underneath where you're at. So that's why you're always lifting everything up and away from her organs. There it is. I always try to put anything sharp or anything that's being careful with right there on the center so it doesn't fall off, it doesn't get lost for the most part. And if you look, that's exactly what she had, it's her spleen right up underneath there. So you never want to press down. And then I'll take my finger and actually move the spleen up and over a little bit. She's a long little dachshund, so her cavity, and there you are. And as I pull up, the uterus is always going to have kind of a different look. It's unique in what it looks like. Now, puppy dogs, especially because she's in heat, I'm pushing her belly down, but I'm not pulling up with her uterus that much, and I'll just use one, and all it is to keep the fat out of the way of my suture material and my fingers. As you can see, you got your measures there. There is a pocket that occurs in all animals right down here that I always aim for. I may not get there, but I always aim for it. Okay, so if you see this, we're going to use caramels again. On the other side, you'll hand me caramels. Caramels are good stuff because they are to be compressive but not damaging to the tissue underneath it. If you cross hatch or your teeth, it can tear because you're moving it, whereas caramels run this way. And so it's basically a rippled effect that you compress things down with. Alright, so since I didn't pick it too, let me look real quick. We'll go with 2. Alright, so these are to help open the abdomen, but they can also be extensions of your fingers and you don't touch things. So here's my suture, and I grab it and pinch it. And I won't open it over my other instruments, open it at the end just in case. And then, because these ends are dirty, they stay off my field. They're put into their little corner. PDS is extremely bouncy, so I try to stretch it before I use it, because it will bounce away from you, have in mind its own. So then I find my same pocket, I'm going to chase it around. Now, before. If you try to get suture closer to your clamp, you'll lose your suture. So what you do is you try to make sure you have enough on both sides to literally make it compressed, but not, and of course, go PDS, it likes to bounce. So I try to get everything out of the way. Now, you can accidentally, non-intentional, I check and make sure I'm all the way clear on this side of the wall, so I don't grab any of the wall or tissues with it. And the same thing, I'll weight this down, because I'm doing it by myself. Kind of hard for you to reach over, but I'll try to leave things in the middle. And I kind of wiggle it a little bit, because you're going to compress your fat, and it will expand, but you want to get close enough to your vessels that the whole reason that you are closing them off is complete occlusion of the vessel. So there you go. So now I know my vessel's closed, but I'm going to go ahead and keep the pressure on. And I throw 4, and then I come back, bring this around, go through my pocket, so I'm leading my suture back through. Get you, bouncy stuff that you are. I'll bring this back around. Now while you're doing a procedure like this, remember you cut through blood vessels getting to where you want to go. So sometimes those blood vessels will, if you don't cauterize them, cautery is wonderful. Alright, so now, try to tighten that up, make sure I'm off of this wall. And I'm always watching the end of my suture because it's so bouncy, it will pop into things, and I don't want it to, I want it to stay sterile. So, plant that down again. This time I'll throw anywhere between 5 to 7 sutures, on the suture. And we'll come down and trim it out. Now this is dissolvable, so she won't have that there. And then when I'll come back, probably I tell you what, let's use one of these guys. Use your car molds. And I'll come through. And what I do is I take it and I expand it that way. Go away from her body, so that when I cut, I can actually give myself some materials there on that stump. It just holds better. So then when you get out here, and we've already gotten to your bifurcation, get out here, I'm going to kind of, and this is that broad ligament, you just spread it out and see where you are, and that way I use my little instrument. So I'm showing these so you'll hear me certain stuff. So I use my smallest clamps that I can and gather all of what's in that broad ligament. And they are vessels, they're small. For the most part, now when she's pregnant, they're not. Because they're feeding along that edge. And I'll just come along with my same suture material. Go over, get off my. Okay. This is so stinking bouncy. I kind of grab my tip and I just arrange everything before I tighten it because it wants to bounce away. And that will compress and pull together all of your little tiny vessels that run along that wall. It also helps in the fact that you don't have kind of this open shredded edge. Now, it used to be a trend that you would tear that with your fingers. I still do in some instances that they're really tiny little ones, and I'm using more suture, trying to close that edge. Oh, I better grab that edge. It's in there, but not in this. There we go. Now you let go. So you can bundle all that down that way. And the same thing Now, either one of those will hold, but remember I got a grip on where I was at. I'm gonna lay it down in there. Make sure all my wall is away. And remember I put that gauze in there, so pull my gauze back out. All I did was press down that. Okay, so here's your bifurcation. Those are really nice. Let's see. Your major vessels, one along the side, you'll gather all of them. I'll go ahead and extend her up and out of here. Now sometimes the spleen will sit right on top of your ovary here and I'll have to push it back. So I'll grab a new gauze. Nice clean one. See here, there's your spleen trying to push down. And I'll get that up and out of the way. And I just basically gather all my. So now, same thing, there's your pocket down here. Let me get my mask. So go ahead and hand me that clamp. Because I used that one for my first hole. There you go. So I'll stand it up and I've got my knuckles down, kind of pushing on her hip so that I push what's underneath her away from what I'm clamping. Alright, so I've already got myself somewhat, and see it bounces everywhere. Loaded. And also another tip, if you're trying to feed suture material through, keep this side nice and smooth. You don't do something like this, because if it's really strong suture, you can actually poke into something, and you don't need to. And especially if you're carrying a needle, say you have to be at this end, I will sometimes, if I have to drive something through and I know that it's going to be, I'll drive it like this, so I'm not cutting anything with that edge. So it's kind of a guard, so you don't do damage you shouldn't need to do damage. Okay, so we'll put all these guys up. So now, same thing, I'll come up and measure. Sometimes they're very tight to the belly and I have to use something else with her. She's got space. And I'll encircle in. One more time. When I do my turning over, that makes my compression on the other side. Now, with her, let me open this up a little bit more. If you can get her to come down some, she may not. There we go, that's better. And same thing, I gotta balance it so I can get it away from her. Sometimes there's enough fat that you really have to work hard. I might go a lot of tail there, but that's okay. Now, you have to find another one, so I gotta clamp through again. There we go. Of course, there's my ovary, right there. And most of what you see here is fallopian tube, which has never really been a problem. If you left some, it'd be great if you don't. As much as I can, give her a little bit more, because she's really close on that side. So you'll expand that broadly and then again, and I need the smaller one. still very microscopic blood supply to places that you don't see a vessel, but certainly don't aim for one. And if you look down here, that's her colon. So it has a completely different appearance that's there. And even her small bowel looks different than her colon. They all have kind of a different shiny color or look to them. I'm not worried about cutting that edge. We'll just cut this one. Right, there you go. Alright, so I'll get through that stuff. And I'll keep this clamp in my hand while I'm moving this down and in, so it can literally lay down in there. Now you may get around a veterinarian and we'll let it snap down into that hole, and some of them will, and they'll pop away from your skin. I was never comfortable with that because I thought, there it goes, and oh my gosh, what if something's wrong? You just sent it flying. So now you can see there's ovary, there's your two horns. Alright, so I need that clamp again that I was using before. There you go. Put this guy over here. I don't need that right now. Alright, so what I'll do is I clamp my curve away from what I leave in there. And why I do that is you see how it spreads, kind of a triangle. And that allows your ends, your vessels are going to be here. And when you tighten it down, then those vessels come to the middle. If you flip it the other way and it's curved in, those vessels have a tendency to slip and slide a little bit more. So it just works a lot better. So same thing, cover my tip. Feed it through. Watch out where it's slinging around in front of you. So I'm going to circle around. Come under. And then I'll tighten. And you see how you see nice and white on both sides. And you've got compression there on the back and the front. And I'm gonna need, I should have one. You're gonna have to give me the two largers of those in just a second, as soon as I get this knot off. Now, I'll go ahead and grab my needle and get it out of the way. So now, because I don't have another one, what I do is I make sure my vessels, and I'll need the other size. There you go. Right, I'll go ahead and make sure I compress both, because remember you've got your teeth here. I'm going to compress both of them. Save that, there we go. So when I come back with my blade, and I'll remove it, I can make a nice sharp edge there. And these I'll get folded up. Over there. Now, same thing. I don't let it pop in there. I also will usually take some of my momentum and kind of cushion it. Now we're back closing it. And I'll get a fresh one and dab my edges. I've been in and out, in and out. I don't know if I have enough. I may have to get more suture. Let's see how she does. Now I hold on to her subcute, and you'll see that white line there. That's what I want to close, edges to edges. So I'll pull it up and away, because there's her spleen sitting right there looking at you. So I'm actually working, when I pull her cavity and her muscle wall up, I'm not inside her abdomen at all. tub. Make sure it's holding. And then I keep tension up and high, so it'll actually, bouncy stuff, it'll actually keep that wall. And you can always look to the back of the wall, make sure you're picking up if you want to. Yeah, now how do you do that? Keep yourself sterile. That's what these guys are for. So I take my hand, I completely cover my hand. Over here, I give my knee. Put that too. And then this, of course, is dirty, right? So I take it over here so I don't forget. And it goes in its own little world over there. It's weird how you learn how to do things by yourself. But assistance is always nice. And see, I'm trying to make sure I catch that inside membrane so that it closes and it heals the right way. And in a perfect world, you'd always stay on your white line. That's not always happening, but that's what you aim for. Now, because this is opened up, I'm going to go all the way here and make sure I pick up the inside lining. And there has to be a certain amount of tension for that suture to make a hole, but you certainly don't want to do too much. And so I've got it at the end, and these are nice and snug. And I'll go ahead and put my knot to the side, and it's not on top of my suture line, or on top of my incision line. Right. And then, as an added feature, if you cut your suture, it actually is more secure than leaving a bubble there. Because if anything should happen, of course I have so many throws. So I've done muscle wall, I'm going to come back and get subcutaneous. I'm going to feed that down in there. She's not a fat little girl, so her sometimes you have to keep working with it, working with it. And I try not to place one knot exactly as the other, because what happens with that is owners can feel it right through the center. And they're like, wow, there's this big something there, and it's, of course, the knots in your suture. So I try to lay one layer on top of the other to kind of give them their own pocket. See, now this is intradermal. Now, because PDS is so bouncy, I have to be kind of really careful with it because it'll twist and turn and tighten up on you.
Demonstrating capping, masking, scrubbing, and gowning for surgery, as well as gloving. So firstly, what I'm going to do is I'm going to go ahead and scrub my hands and my arms. So I'm going to go ahead and remove any bracelets, jewelry that I have on. Okay, so I'm going to go ahead and start running my water. Okay. I have my surgical scrub here. So I'm just checking underneath my fingernails. I'm just making sure that there's no debris underneath them. So I'm going to go ahead and go in and start scrubbing the backs of my hands. And I'm going to go to the side of my hand. I'm going to make my way. Okay. And I'm going to make my way up my arms here. And I'm going to make sure that the water is draining off of my elbows. So with one hand, I am just going to go ahead and dry one hand with my sterile towel here. I'm just going to make my way down my arm. Okay. And with the other hand, the same thing. Okay, I'm going to go ahead and head to the surgery room, and I'm going to make sure not to touch anything to maintain sterility. Okay, and for this part, I'm going to go ahead and put the drape on. So I'm just going to go ahead and unfold and place both arms through. And if you can just go ahead and tie that. You want me to rip the tag off? No, that's fine. And I do not yet have my hands through the gown. I already have my sterile gloves open here. Can you please open that one side? So I'm going to go ahead and grab my sterile glove here. ahead and take my other hand and do the same. Okay, and now the gloves are over my sleeves, and I maintain sterility through the whole process. And that is how you scrub, cap, gown, and glove for surgery.